Jai Hatkesh, Dr. Rohan Nagar.
Jai Hatkesh, Jai Hatkesh.
As you are aware, Dr. Nagar, Mumbai ma be mandalo છે આપણે નાકના અને we have made a program to reach out to young achievers who have achieved something in their career, who have something to share for people younger to them, maybe 5-10 years younger to them, so that the youngsters can emulate from them, learn a lesson or two, and which will help them in their career. These days, of course, education plays a very important role. You squarely and surely fit into this category, and congratulations for that. Not that
Thank you.
Thank you. Looking at your CV and your website, it is very clear that you are an accomplished person. It so happens, for the information of all our viewers, that you have just, permit me to do that, just completed 40. Our cutoff is 40, but we are making an exception, and I think a correct exception, if you like, for Dr. Rohan, because he's just crossed 40. He's just a few months above 40, but his accomplishments overshadow his crossing over 6 months. So we are happy to have you on this show, Dr. Rohan.
Thank you. Thank you so much.
Your CV tells me, and you have an excellent website, it gives a lot of detail about what you are doing. Rohan, incidentally, is in London. He practices Ayurveda in London, and there are not many people who practice, as per his site, Ayurveda in London. He's qualified himself after doing his MD in Ayurveda in Jamnagar, and he's been practicing for last 20 years. He's got a practice which spreads over UK, India, USA, Croatia, and Spain, right? It's Germany, right?
So Germany and Netherlands. Yes.
Netherlands, yeah. He is a regular speaker and a contributor on various newspapers. So he's got a multifarious face, activity, and a personality. First question: you did your masters in Jamnagar, as you were telling me, and you went to the UK. You went to a greenfield project place, or because India is a place we understand Ayurveda? Why UK?
So it's a very, very interesting story. I was basically nominated for one of the best presentation of the paper in International Vaidya Sabha in Delhi, which was organized by the Health Ministry. And that time our Health Minister was Sushma Swaraj.
Oh.
So I was nominated for one of my paper presentation for kidney and liver disorders. And they have chosen the 10 good papers, and one of them was mine. They loved the paper for the research purpose, basically, how Ayurveda can help liver and kidney disorders. So we were talking about, because there was international Vaidya Sabha, so all over the world, whatever the Ayurvedic doctors can make it, they all came there. And in the speech of Sushma Swaraj, she said that Ayurveda should go global and help so many people, so we can say that our science is basically globally helping the world. So that idea clicked, and then I met a couple of guys there who are basically from Netherlands, Holland, practicing Ayurveda in a very, very small kind of practice there. And that's where the whole passion started, to go into the internationally and see what Ayurveda can do. Also, in that time, I found one more very important thing, because when there was no Ayush Mantralaya, there was no Ayurveda Mantralaya basically by government. There was just normal Ayurveda practitioners everywhere. And I saw in my own class, out of 90 people that had basically done Ayurveda practice, but they're all practicing normal GP. They are just practicing medical science. And that was quite disturbing. You learned one of the best science in the world, but you are not putting into practice. So maybe a couple of guys, 3 guys in the whole class who basically adopted the Ayurveda. And that's where I thought that nobody likes their own mother. They just want to go outside and see what exactly is happening. And then I got a chance I got a 3 different approach from Germany, Netherlands, and UK. One of the best people who are into the research of complementary medicine, and they approached me and they said, Dr. Nagar, would you like to come and see what we do? We are on a very, very basic kind of thing, but we would like to have your input. So I went so I came in UK in 2004, to be very precise, 4th of April 2004, I came here. And then my journey basically started. It was a very, very tough journey. British people being snobby, hard to convince them. It was a very hard work for me for the first couple of years, but now they are my fan.
I forgot to mention that you also done your PhD in Vedic astrology. You have
That's
done
right.
a specialization, as you mentioned, in liver, and you were inspired by something medical condition that your dad had. So, can you tell
Yes.
us about your and that must be in your early age when you were in your growing up days. So that
Yeah,
influenced your
so
decision making. Yeah.
absolutely. So my father was diagnosed in 92 for a liver cirrhosis, and it was a very tough time for the family because wherever we go, every doctor says that this is the end of the life, maybe 6 months, 1 year. And fortunately, with the God's grace, we found an amazing Ayurveda Vaidya in Gujarat itself, in Ahmedabad. Very, very kind of a very secluded practice, but lots of queuing people outside. That gives us the idea that what kind of a magician he was. So he started his medicines, and with the God's grace, you can see him now. He's glowing with no issues anymore there. His liver has been treated. So that was the first impression in my mind that how the normal medical practice can't help him, and how this amazing Ayurveda has done this kind of a huge change.
So when you did your, because maybe that inspired you to do a further research in liver because your dad was suffering
Exactly.
from that, and
Exactly.
there was a case in front of your eyes where he was cured and he's hale and hearty. Touch wood, touch wood. Yeah.
Thank you.
Having said that, you did your research in liver, on the liver condition or whatever research it was, and you got an opportunity to go to the UK, and you said the UK people are pretty snobbish. Not to generalize, but acceptance is rather low. You can probably put it that way, right? Uh,
Absolutely.
what was it that kept you going in spite of?
So the first thing, I'm basically a very stubborn person. Once I decided I want to stay somewhere because I don't want to lose my passion. I have seen also many Ayurveda doctors in London. They're working in supermarkets and post office, and they just lost their passion. And I decided I'm not going to do that. So I have started searching for right people to put me in the right place. And luckily, I found one lady. She was basically a South Indian Singaporean. She had a beautiful spa in central London. And she called me and said, Dr. Nagar, would you like to become a chief consultant? And that was the beginning of my whole era. I just joined that place, and starting from the whole Hollywood industry, all celebrities of all the MPs and British people, the area, the spa was, the place was in a very significantly in a central London where big head people used to come. So I started convincing them, and I started telling them what Ayurveda is and how you can change your life completely in Ayurveda rather than going into the medical science, which is full of chemicalized pharmaceutical giants controlling those things.
Yeah.
And that's where the whole thing
That
started.
reminds me of a statement by one Dr. Hegde. I'm sure you heard of him. He's a very known person.
Yes.
I don't know why he's still not got a Nobel Prize. I'm sure he's a sure candidate for Nobel. He says that every ill does not have a pill, but every pill has an ill. Yeah.
Very right.
Yeah.
Absolutely.
Yeah.
Absolutely.
So you also done, you said you have done some specialization in Nadi Shastra or
Prediction. Yeah, pulse
Nadi
diagnosis.
Prediction, pulse diagnosis. Is it very effective? How does it happen? You look at somebody's wrist and, I mean.
So it's a part of a journey when we studied Ayurveda. We have a whole year of practice of pulse diagnosis, which is called the Nadi Prediction. And in that Nadi Prediction, we are queuing up hundreds of people of one same condition, like a diabetes patients or blood pressure patients or cholesterol patients, and we need to put our three magic fingers on their pulse and feel how that pulse basically sound. And Ayurveda always discuss about this pulse. Everybody knows about it, Vata, Pitta, and Kapha, which is Vayu, Pitta, and Kapha. And we just need to feel that because every nadi is connected with the three special animal, which is frog, snake, and a swan. That is the speed and the warmth of that nadi. And once you basically try to understand those things, and with this kind of experience, seeing 300 patients a day in the OPD, you basically get quite yes into mastered in that kind of science. Yeah, so that's what I did.
You also done PhD in astrology. So how does astrology and medicine, does it go together? I mean, for a human being? Yeah.
So it's a medical astrology. If you look at the human, when you look at the chart, the birth chart, every house controls certain parts of the body. So when you have a certain planetary position sitting there, you can see this person is definitely suffering from this kind of condition. So giving one example, if you have a very aggressive planets in the first three houses of your chart, we can say that this guy definitely have some glasses or a problem with their teeth or constant migraines or constant headaches. So this is kind of a combination of medical astrology, which I also use sometimes when I need to.
Okay. Yeah. So you see, to start a greenfield project in a country, as you said, where people are snobbish or difficult to accept or call it whatever, you created a practice and you went international. Two questions: why did you go international if you thought UK was the place? Why international? And second is, what keeps you going every day? Because you are facing a huge lobby of the pharma industry. Right.
Yes.
So how do you sort of at a young age? I mean, you got many years in front of you, and you don't have many years behind you, because you've been there in UK for almost, as you said, 15, 20 years, I think. So
Yes, it's
how do
16
you
years.
and you said that you are a stubborn person. I mean, I'm just quoting what you said. So are you saying that every individual who wants to achieve something in life has to have this quality of being stubborn, or what have you?
Yes, so positive stubbornness, yes, towards
Yes.
achieving something, and the passion for sure. Doesn't matter how the environment is around you. You need to make sure that you should have, first of all, the trust in yourself and trust what you do. And that's what I exactly did. Started Ayurveda in UK. Why I went global? Because I saw many people are getting better, and the patients who I'm used to see, they started connecting me with some international patients as well. Because as you know, the world is very small now. So if the one family comes and they get better with my treatment, they connect with me. Some patients in US, some patients in Germany, some patients in Netherlands. Also, I was lucky to give, because I'm a visiting professor in a complementary medicine institute in Germany, Croatia, and Holland, Netherlands. So that's where I also got connected with a lot of people. And surprisingly, rather than UK, the whole Europe has a huge acceptance for Ayurveda. So if you go to Switzerland, you go to Holland, you go to Germany, they love Ayurveda. They love it.
These countries are also quite exposed to homeopathy, isn't it? Is that so or not so?
Very right. So Germany is very high in homeopathic because it came basically from there.
Yeah.
But the Ayurveda is taken there up, being connected with the nature. As you know, that second largest language basically learned or spoken in Germany. They are in the universities nowadays is going to be Sanskrit. They are pushing Sanskrit a lot. So that's where the whole things basically started. That's why the people love Ayurveda, because it's connected with Sanskrit and nature and all the Vedas.
See, Ayurveda, as I understand, and I'm sure you must correct me if I'm wrong, is a way of life. It doesn't treat the allopathy is a reductionist system of treatment. Right? You have a headache, you get a pill, it cures
Very
your
right.
headache. Ayurveda doesn't do that. It finds out why you are
Very
having
right.
a headache. Is that the correct understanding?
Very exactly.
Yeah.
Exactly.
So,
So
yeah.
we are not a quick fix. Very right.
Yeah. Yeah. Also, the whole mechanism, allopathy works on a linear progression of anything that you're doing. Even the research that you do of arriving at a chemical, now they are trying to find out this for the viral that we have, the pandemic that we have. They're trying to find out a linear progression of, like a machine. If this happens, this happens. If this happens, this happens. Ayurveda doesn't. So in these
Very right.
times, the question is, in these times, when the life is so competitive, is so stressful, so demanding, things are changing. So the life today is not the same that was there when Ayurveda was at its height. How do you match those
Very
things?
right. Very right. So that's a good question. When I started my practice in Ayurveda, I was giving my patients the same diet which used to be given in India for many years for the patients, and I thought that's not a success because people didn't like that kind of diet. They cannot just stop everything eating and live their life. So as for the Western world, I have changed the whole approach to the Ayurveda now. I changed the diet, I changed the dietary, I changed the lifestyle management programs. I have my way of doing consultations are different, and the whole way I'm putting them into the whole treatment, it's rather than a quick fix or 3 months or 6 months thing, is kind of a good year kind of lifestyle program, and that's why they love it. And as you just said, that medical science, it's only symptomatical treatment they do.
True.
So when you go to them, they just give you a symptomatical treatment, while Ayurveda is more into the root cause. We find out the root cause where it basically started, and that's why I tell my all the patients, the first condition I tell them is, if you are not following the diet I'm going to give you, sorry, I can't help you, because human body is like a machine, and if you want to increase the functionality of the machine, you need to change the oil regularly, and you need to make sure there is a regular cleanse should be done. And that's what we are going wrong. We don't do the cleanse, and that's why we're getting sick and ill.
Yeah, your site also speaks about a lot of importance to meditation. Now, meditation is something which India, I can say, invented. And there are so many forms of meditation available, so many. Right from the time of Buddha when Vipassana was there, and now we have so many types of meditations. How does one meditate in these times when there is so much of noise and various types of pollution in the air? Even, for example, all the mobiles and all the wireless things that we have, I'm sure they affect your brain, isn't it? Brain cells, if you like. Yeah.
Of course, that's the first thing. Sukhasana. Sukhasana, what Ayurveda speaks about. You need to get physically healthy first, then you can get mentally healthy. So if you want, if I saw so many of my clients or patients, they cannot sit for 5 minutes in a meditation. That's impossible because they started having the back aches and knee aches and pains everywhere in the body. So in the time of this, as you just said, high stress time where pandemic is going on, lots of electricity and electronic gadgets are around us, how we can concentrate. And that's what we have created in London. We have created a retreat where we are telling people to go there, or maybe create that kind of retreat in your home itself, because God has given you this pandemic time where you are staying in your own place, cutting down yourself with the world. But yes, we need to cut down the electronics. We need to stay away from them. There are rules which we have created, 5 to 7 rules. If you follow those rules, I'm sure you can definitely meditate, you can concentrate, or being more attentive.
Sure. So every time you see a person who's converted, if I can use the word, converted from regular medicine, that is allopathy, to your Ayurveda, probably he uses both for some time and then he maybe switches over purely to, maybe that may be the progression that any patient may be having, right? How does it feel? Tell me about the emotional feeling as a doctor that you have, that here is a person, as you said, there are a lot of cases, and your practice grew international because of networking and because of reference. So your practice is referral practice rather than, and you can't
Yes.
advertise as a professional. You can't. I mean, I'm sure you can't.
Word of
Advertise.
mouth, word of mouth,
Word
for
of
sure.
mouth.
Word
Yeah.
of
So it's
mouth.
referral. Basically, it's referral. And it's anecdotal.
Absolutely.
It is anecdotal because you don't have any theories to prove that. Unlike the research that is there in allopathy. So it is a lot of anecdotal stories would be there. So how does it feel when you see a patient cured through Ayurveda, where he had gone, and you've seen in your dad? So you have something behind your in your childhood, and now I want to hear that. How does it happen?
So I done my one video on my website. I say that in that video that people thinking Ayurveda as a last resource rather than their first resort.
Right.
Everybody comes to the Ayurveda at the end. So I have the most difficult cases in the world. You can imagine. I have
Yeah.
seen all the way to advanced stage of cancers and everything.
Right.
Now, when I basically treat them, I have thousands of emails and phone calls and letters, and people are blessing me. That blessing makes me keep going. You ask me, like, what makes you keep going? These
Yeah.
blessings, those letters, they said, Dr. Nagar, you are a musician. We never thought of that you can take us out from this. There are so many conditions, including skin conditions, liver conditions, that medical science doesn't have an answer for that. They have an answer for only steroids, antibiotics, and those kind of things. So that's why I come in the picture, change the lifestyle, tell them what to do, put them on the track where they start feeling that things are happening for them. And when they see the results, they have, the whole family has literal tears in their eyes, and they say, Dr. Nagar, if we never gone onto this place, we never basically would have come out, because they started from the 2 pills and now they have 20 pills in a day, or maybe a 40 pills a day, that they are not going anywhere. So I think Ayurveda has some magic, and I've seen it and I proved it.
Proved it, yeah. So also, we are almost coming to the end, and we have got a few minutes left in the scheduled time
Sure.
that we allocate. If you were to suggest advice, if I can use the word advice, to the youngsters, especially back home here in India, and maybe some Indians out there in UK, USA, wherever, what would be 2 or 3 pieces of suggestions, advices that you would want to give if they want to make a career, especially in a greenfield project? I call it greenfield project because you have ventured into an area where people acceptance was rather low, right? As compared to whatever established practices are there. What are the 2, 3 things? Because everybody, in my view, there are a lot of opportunities that are available to the youngsters now.
Yes.
It is not necessary that a child should follow the footsteps of his father as far as his career is concerned. So
Very right. Very
you
right.
are bombarded with multiple options. In this
Very right.
scenario of multiple options, and you do not know, you're too young to choose. What would be your suggestion, advice, stroke, whatever, to the youngsters from a successful person like you who's gone international?
So three things I would like to say. First of all, please follow your passion. That's number one. Do not follow what the society is telling you or your family or parents telling you, because your passion can take you somewhere where I am now. Everybody was forcing me to become a medical doctor or engineer, but I saw there's a huge success in Ayurveda. I can say Ayurveda was a success in the past, present, and the future is Ayurveda. So if any youngster would like to take an opportunity to become an Ayurvedic doctor, I can assure them the future is bringing a lots of success, and the future is only Ayurveda. I can say that. Even in the corona, I can say that all of my patients who have followed my diet regimes and they've taken my medicines and for immune boosting things, they never caught any infection. And that is quite assuring that what Ayurveda can do. Unfortunately, as we just said, the pharmaceutical giants are there to conquer us in a ways they want. But the globalization of Ayurveda is getting bigger and bigger. So youngsters, especially in our Nagar Samaj, I can just say to them, if you really are having a passion to become or a healer or help people, you want to feel that kind of a blessing or feel that contentment where you want to feel the satisfaction of healing somebody or treating somebody, Ayurveda is the best to go. Ayurveda is the only to go.
So basically, follow your passion and don't worry about what the society has to tell you. Don't get influenced by your peers. You have a passion. Could be Ayurveda, could be
Absolutely,
anything.
absolutely.
Could be
Yeah,
just about.
anything. Yeah, one of the passion has to be there. I heard one sentence from my professor. I would like to quote it here, that Rohan, whatever you do in your life, just go to the top. Don't stay in the middle, and don't stay somewhere in the bottom. So whatever you choose, you make sure you target the top. You target the peak, the summit.
Yeah, I'll take the liberty of extending this by another 1 or 1.5 minutes. You have a helicopter view
Sure.
sitting in London about youngsters in India. I'm sure you must be coming to your home country. You must be coming to Ahmedabad, Bombay, wherever, and seeing lot of our community youngsters. How do you see them in terms of their application, in terms of their effort, in terms of their commitment, in terms of their, I mean, see, you have to be born lucky uh, to be born in a Nagar Brahmin community, right? Your
Absolutely, absolutely.
economic condition could be a factor of so many things, but at least being born to Nagar parents is something to do with your good karma. I think you take that. Even astrology
Absolutely.
may support that.
I believe that.
Having said that, what are the
I
two
believe
three
that
things?
100%.
Oh, good. What are the 2 3 things that you see it very loud and clear on these youngsters when you look at them, and when you say that, oh guys, you're born in good families. I mean, good community, Nagar community, Brahmin community, and why don't you guys do this? Something that you see, which is so very apparent, which, as you said in your astrology, some girls are very powerful, and you can just see them. You know, a blind person can see them.
See, when I have a view of youngsters in India nowadays, especially getting connected with quite a big amount of Nagars in India as well, the youngsters are becoming achievers nowadays. It's not like before, where they were not they were thinking about where to go. In my times, I was quite. I'm telling you, it was a quite feeling of a handicap that if you didn't become a doctor or engineer, you just thought that life is finished. So I think the resources are so many there. I think all the youngsters should go to that, achieve that, grab that. Opportunities are so many, and those opportunities you can convert into the success. What I did. So this is what I want to tell all the youngsters, that yes, you can follow the Western world, but stick to be grounded. Stick to your
Core
own world,
values.
and because exactly, India has a lot of to offer. Don't think that, oh, I want to just become a graduate and just fly to some foreign country and make my life. Don't think that, because now the whole world is looking towards India for a success. So I must say that be grounded, and then don't leave your values, as you just said.
Oh, absolutely. It's very nice to hear from somebody out there on a helicopter view. It says, be grounded and follow your passion. and there are many options available. Thank you so much, Dr. Rohan Nagar. It was an absolute pleasure. As we said, we made this exception.
Thank you.
I think we did the right thing, and I'm sure our talk, the small chat, would play some important role to people who choose to listen to this video to the whole end. I wish you all the luck. I'm very happy that we connected, and I wish that you're
Yes, I
able
am.
to.
Thank
If I can say that I would be. You would be there in my prayers to say that you're able to expand Ayurveda in a foreign country that you're there. Thank you so much.
Thank you. That's a great help. Thank you, Mr. Pandit. Thank you very much for taking me on. Thank you. Have a great day. Thanks.